So, you're a cat person, right? You've probably heard the term cat scratch disease tossed around. But what is it really? Today, we're going to peel back the layers on this and break down exactly what every cat owner should know.
We all know it, that playful little swat from a kitten, or maybe a little nip during playtime. It seems totally harmless. But what if that little moment could actually lead to something, well, something more? That's the question we're diving into today.
All right, let's start at square one. What in the world is cat scratch disease anyway?
Okay, so at its heart, cat scratch disease is just an infection. It's caused by this specific bacteria called Bartonella henselae. And just like the name says, the most common way you get it is through a scratch or a bite from a cat that's carrying the bug.
Now here's the part that might surprise you. Your cat is probably fine. The vast majority of domestic cats, and especially kittens, are just carriers. The bacteria hang out in their blood, but the cats themselves, they're usually perfectly healthy, not showing a single symptom.
So, if the cats aren't sick, how does this bacteria even make the jump from them to us? Well, it turns out there's a tiny and kinda sneaky middleman in this whole journey. It all starts with fleas. Yup, fleas. They're the ones who infect the cats in the first place. The bacteria then set up shop in the cat's bloodstream. And from there, the cat can pass it along to a person, not just with a scratch or bite, but even by licking an open cut you might have.
And while anyone can get it, the data shows that it's most common in children, which, when you think about it, makes a lot of sense. Kids and kittens tend to have that rough and tumble kind of play that leads to more of those playful scratches.
Okay, so let's say the bacteria has been transmitted. What happens next? Let's walk through the typical signs and symptoms you should actually be looking for. The first thing you'll probably notice shows up within about 3 to 10 days. It's usually a small red bump right where the scratch or bite happened. It's kind of weird because it's usually painless and it might get a little crusty. Then, within a couple of weeks, the lymph nodes near that spot will start to swell up and get pretty tender. Along with those swollen glands, some people might start to feel, well, just crummy. You might get a low-grade fever, a headache, or just lose your appetite and feel run down. But here's the good news, and it's a big deal. For the vast majority of people, this is really not something to panic about. The disease is typically mild and just goes away on its own. No special treatment needed.
However, and this is so important to understand, there's a major exception. For anyone with a weakened immune system, like someone living with HIV or AIDS, this is a whole different ballgame. The infection can spread through the body, and without treatment, it can become incredibly serious, even life-threatening. This is the critical thing to remember.
So, with these different potential outcomes, how do doctors actually figure out if you have it? Let's get into the medical detective work. The main way doctors diagnose this is with a pretty simple blood test. They're just looking for the antibodies your body creates to fight off the bacteria. Now, if it's a more serious case where things are a bit unclear, they might take a fluid sample from a lymph node for a PCR test or even do a biopsy just to make sure nothing else is going on.
All right, let's talk about the path to recovery. How do you get better? And even more importantly, how do you keep from getting it in the first place? The treatment plan really comes down to one thing: how strong your immune system is. It's like two totally different playbooks. For a healthy person, it's all about managing the symptoms. Put some heat on it, take a pain reliever. Antibiotics? Usually not necessary. But for someone with a weakened immune system, the goal is completely different. The focus is on wiping out the infection with antibiotics, sometimes for weeks or even months.
So this brings us to a really crucial piece of advice for prevention. If you're in that high-risk, immunocompromised group, the safest bet to avoid this particular disease is, unfortunately, to avoid domestic cats.
After hearing all of this, I'm sure there's one big question floating in your mind. Should we actually be afraid of our cats?
And the answer for almost everyone is a resounding no. Absolutely not. This isn't about being scared. It's about being smart. It's about awareness and basic hygiene. Honestly, your best defense is just to wash any scratches or bites right away with soap and water. It's a super simple step that keeps both you and your furry friends safe and sound.